So here we're looking at the 4 abdominal muscles, and you can see me palpating the transverse abdominis. So this is the deepest of the 4, and it's very much like a corset. So it originates from the iliac crest, thoracolumbar fascia, and ribs 7 through to 12, and also the inguinal ligament. Its insertion is the pubis and the fascial connection of the linea alba. So its function is to actually compress and support the abdominal content, so very much like the corset.
So the next muscle that we're going to look at in this group is a group of muscles called the internal obliques. Now, they originate at the iliac crest, thoracolumbar fascia, and the inguinal ligament, so really similar to that of the transverse abdominis. However, a little bit more sort of lateral, these ones, and their insertion points, ribs 10 to 12, and the fascial connection to the linea alba. This is the ligament that runs down the centre of the abdomen. Now, their function is going to be rotation of the spine, as well as lateral flexion of the spine, typically contracting in isolation.
So the third muscle we're going to look at now is the external obliques. So these work in the opposite direction to the internal obliques. So they start from the outer surface of ribs 6 through 12 and insert onto the iliac crest, the pubis, the fascial connection of the linea alba. And again, their function is exactly the same as the internal oblique. So they rotate the spine and laterally flex the spine. This good way to remember these is it's actually a bit like putting your hands in your pockets. So they run in the same direction as if you were to slip your hands into your pockets.
So the last muscle then in this group is the rectus abdominis. Now, this is the group of muscles that most people are familiar with, sort of looking at forming your six-pack. Now, origin is the pubic crest and the pubic symphysis, with insertion points, the cartilage of the ribs 5 to 7, and the base of the xiphoid process of the sternum, so muscle fibres running upwards here. Now, its action when contracting unilaterally is going to be lateral flexion of the spine, where bilaterally, so when sort of the left and the right side contract together, we're looking at flexion of the spine and also some posterior tilting of the pelvis.